I'm Mrs. Princey, Associate Professor in Mental Health Nursing. Today, I'm going to talk about another important topic, which is a part of the psychotherapy. This therapy involves a movement of the body, which is going to help out the clients who will not be able to verbally express about their feelings or emotions. They can express it in the form of the movement. So, one such therapy, which everybody loves, right, is the dance therapy. So, what is this dance therapy you're going to learn today? Dance and movement therapy, which is termed as DMT, is a psychotherapeutic use of movement and dance for emotional, cognitive, social, behavioral, and physical conditions. So, through the help of the dance or the help of the movement, clients with all these problems in the areas of emotion, cognition, social aspect, it can be behavior or the physical conditions, can really cope up with these kind of the difficulty. What is the ultimate purpose of the dance therapy? The dance and movement therapy, the ultimate purpose is to find a healthy balance and sense of wholeness. Okay, so that is the main purpose of the dance and movement therapy. Let us see the definition of the dance therapy. It is the functional application of various forms of dance by the usage of the group of muscles to bring certain effect to modify the client's behavior or altering client's behavior. So through the movement therapy or through the movement of the group of the particular muscles, they will be able to bring about a modification or alteration in the behavior of the client. Moving on to the uses of dance therapy. Number one, it promotes the psychotherapeutic use of body movement. Okay? We know that the mind and body is connected. If any problem happens in the body, it is going to affect the mind. Anything which affects the mind is going to physically affect the person. So, through the use of movement therapy or through the use of a dance therapy, we can bring about the promotion of the psychology of the person or the mind of the person by the movements. The second use is the client will learn to express his ideas, thoughts, and feelings through the motor activity by keeping the varied dance positions. A dance, if you take, we have got the various, positions, the various movements we have, which is going to express a particular, idea of a person. So through these varied movements or through the varied positions, the client will be able to express his thoughts, his ideas, or his feelings. So that is the second use of the dance therapy. The third use is going to enhance the communication or the interaction. So we have got not only an individual who is performing a dance or a movement, we have got the group of people or we have got the group of clients also who will be undergoing a dance therapy or a movement therapy session. So it is going to bring about a communication pattern improvement. It enhances the interaction with the various clients. Dance therapy is going to improve the muscle coordination, self-confidence, as well as contentment, right? So dance therapy is the one we have got any physical issues. Yes, we have got the dance therapies which is going to help out us in overcoming those physical issues. Apart from that, it's going to boost the confidence of the person and going to bring about the contentment. He feels complete about himself. So it is a kind of putting out all the emotions and expressions of feelings which the client is actually not able to verbalize. Through the actions or through the movement, he is going to express it out. He feels content about himself. He feels relaxed about himself. Dance therapy is fostering the integration of physical, emotional, as well as the social experience. So we can integrate and we can relate our physical health, emotional health, as well as the social health when we involve in such kind of a dance therapy session. Dance therapy is going to relieve all the tension, stress, anxiety, and worries. So it is a kind of a activity therapy, we can say. Dance is a kind of activity a person does, a movement a person does, right? It is going to help out the client to bring about the release of the tension and worries. When an activity is performed, you know that a happy hormone called as endorphin will be released by our brain, which is going to make the person feel very joyous, happy, and relaxed. So that's how we can, overcome this anxiety, stress, or all the tensions. The next use is it provides the self satisfaction. He feels content about himself, he feels complete about himself, he feels satisfied about himself. It is not only that it's going to really help the client to exhibit and recognize his own talents and capabilities. He wouldn't have known that he has got such a talent, right? So through involving in the dance or movement therapy, it is also helping the client to exhibit his talents and capabilities. The next use is going to promote the relationship between cognitive and conative behavior of an individual. So it is going to integrate the cognition as well as the emotions of the person. That's nothing but it's going to promote the physical and emotional integrity of an individual, a balance between the physical self and the emotions. So these are all the uses of the dance therapy. Moving on to the indications of dance therapy, who are the candidates who can go for a dance therapy or a movement therapy? So dance within a therapeutic environment is not limited to a particular age group. Any age group can select a dance therapy who are experiencing any kind of physical, psychological, emotional, or mental problems. So any age group can go for a dance therapy session. So if you take the physical issues, as I told you, it's going to help out the client who is dealing with the physical issues, emotional issues, cognitive issues. So if you take the physical issues, we have got some conditions wherein the client can really go for this therapy session. So number one, we have got another physical issues like chronic pain, people with the childhood obesity, people suffering with cancer, arthritis, hypertension, cardiovascular disorders. So if you take the mental health issues, the people who are having the mental health issues like anxiety disorders, depression, people who are suffering with the eating disorders, people with the poor self-esteem, who have experienced a post-traumatic stress disorder. So those are the clients who are having the mental issues can even opt a dance therapy session. Next, we have people who are having the cognitive issues. So what are those cognitive issues? We have got people with the dementia and also people who have problems with the communication. We have got people who are having social issues like autism, aggression or violence, domestic violence or trauma, who have problems with the social interaction, problems with the families, the conflicts in the families. All these are going to get a benefit from the dance therapy session. Apart from these, we have got people with the learning difficulties, mental retardation, deaf and hearing impaired people, people who are visually impaired, physically handicapped, elderly group of people, people with the Parkinson's disease. So all these are the various issues that the individual may suffer and they can opt a dance therapy for the treatment. Moving on to the principles of dance therapy. So when you go for a dance therapy session, you have to keep in mind certain important followed. So what are those principles? Number one, mind and body are interrelated or interconnected, so that change in one can definitely have an impact on the other. So as I told you, there is a connection between the mind and the body. If you're not well physically, it is going to affect your mind. If you're not well mentally, it's going to affect your body. So always keep in mind that dance therapy is going to help out if you have physical issues or mental issues. So when you go for a dance therapy, you have to see to it that you should be able to manage or have a balance between the mind and the body. If you're not well in any of these aspects, it is really going to have an impact on the other aspect. The second principle is we have to know that the movement or the dance therapy can express the aspects of personality. So very important when you're giving a dance therapy session or undergoing a dance therapy session, as a nurse, you should be able to witness the client and supervise, monitor the client for his personalities, right? The next principle is a part of therapeutic relationship is the communication. There are times wherein the individual will not be able to express it in the words. So, this dance therapy or movement therapy is a non-verbal communication that which is going to give you an idea of assessment of through the non-verbal way of movement or postures or positions or expressions, you will be able to do the assessment of the client. Another important principle is movements can be symbolic and can represent the unconscious material of a person. So, when you are there as a part of the therapy session, being a nurse, you should be able to understand the movement and understand the unconscious conflict that the client is undergoing. The next important principle is movement improvisation or experimentation can bring about modification in the behavior or can bring about learning the new ways of being yourself, right? So when you try to modify, when you are going to improvise the movement therapy, it is going to make the client learn a new skill or make the client to learn the new coping abilities which he can use it in his life. So these are the important principles that you need to follow when you're a part of a dance therapy session. Now, where will you conduct this dance therapy session? What are the different locations or settings? It can be conducted in the rehabilitation centers, medical settings, education settings, forensic settings, nursing homes, daycare facilities, disease prevention centers, and also as a part of health promotion programs. So these are the various locations or settings you can conduct a dance therapy session. Moving on to the nurse's role or the responsibility of the nurse in the dance therapy. Number one is assessing the client's need. The first thing that you do is you're going to collect the information, do the assessment, you're going to assess what is the need of the client. Through the assessment, you get to know whether a client is expressing his feelings or not. If he's not able to verbally express his feelings or ideas, you can even at least find out what are the interests of the client. And if he's really interested in the dance therapy or dance or movement, you can make him or you can put him in the dance therapy session wherein through his expression or through the movement, at least you will be getting to know about the client. Or he will be communicating through the non-verbal means. And as a nurse, you will be able to analyze the needs of the client. The second responsibility is planning and providing appropriate treatment. So based on the need of the client, you're going to plan and you're going to provide or implement the treatment. Third important responsibility, you should be an active person who is going to be involving actively in the dance therapy sessions and also encourage the client to do the same. Encourage the client to motivate the client to involve in the dance therapy sessions. As a nurse, you should be a part to help the client to understand their inner conflicts through the role play and self-realization. Dance is also one of the role-playing technique, right? So through this role play, you will be able to help out the client to understand themselves, to realize their own self, their inner conflicts, what it is. So as a nurse, you should be As a nurse, you should lend your helping hand to the client to realize his inner conflicts. Another responsibility is you're going to explore variety of the dance styles and movements with the music resource. See to where it is not only the movement that you have or steps or different movements that you have. See to it that you have an appropriate music resource so that the client will be able to definitely make use of the dance therapy to express his feelings or his emotions. Maintain a report or document the client's behavior or client's expression or outlet of feelings. Maintain a confidential notes to keep in confidence the client's various issues. Also be a part to report the same to your colleagues or the mental health team so that you can collaboratively work to bring about a change in a client. So this is the nurse's responsibility in the dance therapy, right? So dance therapy is again an outlet. It is a catharsis, we can say, wherein the client will use the movements, will use the different dance positions to express or to let out his feelings and the conditions like physical, emotional, social issues that he is having. Okay, so hope you all have understood the topic. Thank you.